it doesn't make any sense to use Kisspeptin. Kisspeptin is an interesting molecule that makes a lot of sense physiologically, but that could not see a lot of results clinically. So what Kisspeptin is, it releases gonadorelin releasing hormone GnRH from the hypothalamus that then directs the anterior pituitary to release LH and FSH that then increases sperm count, testosterone, and everything that we want. When you take testosterone, therapeutic testosterone, whether you take it by injection, by creams, it exerts a negative feedback loop to the hypothalamus and the pituitary that decreases your GnRH and your LH and FSH. That's why testosterone therapy is associated with testicular atrophy, decreasing sperm count, infertility, and all those things that we know. So what do we do to try to prevent that? So you want some kind of testicular stimulation. So since we've been doing TRT from the beginning of times, we've always used HCG, human chorionic gonadotropin. HCG is a direct stimulant of LH, luteinizing hormone, and it also has some effects on FSH. So we've always used HCG either as monotherapy to treat low testosterone or infertility in both men and women, or we use it in combination with testosterone to maintain testicular function. In 2020, the FDA put a ban on HCG. No clinics could find HCG anymore. That's when we started hearing about Kisspeptin. I've been doing this for 18 years. Before 2020, nobody was talking about Kisspeptin. Once HCG became unavailable, we went looking for an alternative. And physiologically, Kisspeptin makes sense because it kind of does the same thing as HCG, but even upstream of HCG because it goes to the hypothalamus. And they've done a study where they gave Kisspeptin IV, intravenous, and it showed an increase in LH and testosterone. So it's that study that showed that, wow, it could work. And in theory, it does work, but the study was done intravenously because the half-life of Kisspeptin is very short. So 2020, again, once HCG was no longer available, every clinic, and we did it also at our clinic, we use Kisspeptin because the physiology makes sense. But in reality, we don't see much effects. I do not like Kisspeptin because I don't see the clinical results. So I used it when it was HCG unavailable. That's all we had. HCG is available now. So it doesn't make any sense to use Kisspeptin. I've even seen that they're using Kisspeptin troches. There's no studies on the bioavailability of this. So a lot of clinics I see using Kisspeptin, and they'll tell the patient the physiology makes sense. You want to maintain your HPG axis, your hypothalamus, pituitary, gonadal axis with some kind of LH stimulant. But Kisspeptin has never been shown to work unless you do the IV. And on a clinical sense, we see that all the time. We put the patients on it. In their mind, they think they are doing something great, but I very rarely get. And to me, if somebody gets it, maybe it's more a placebo effect. It's not impossible. You know, everybody's different. Especially the injectable twice a week. I have some guys who told me, yeah, I got more sex drive. My ejaculatory volume is bigger, but rarely. HCG, been studied for decades. You put HCG, most guys will get an increase in their ejaculatory volume, more sex drive. You check their sperm count, it improves. So if you need testicular stimulation, my first choice is HCG, and it is available now. Clomid or enclomiphene as a second testicular stimulation, it works also. I don't like it as much. For clomid monotherapy, we've had some younger guys, 20s or 30s, that maybe respond to it. But the problem with clomid, it blocks estrogen. So, you know, there's guys on clomid who get testosterone in the 1,000, but they feel nothing and they have less sexual drive. So I don't like clomid. So if you're going to ask me, HCG has always been and remains the most important testicular stimulation, whether for monotherapy or in combination with testosterone therapy. Kisspeptin was only talked about. Actually, Kisspeptin was first discovered in 1996. So it's a recent molecule. And you know, it's funny. It's you know where the name Kisspeptin comes from. It's because they discovered it in Hershey, Pennsylvania. Hershey, where they make the chocolate kisses. You know the kiss chocolate? So that's why they call it Kisspeptin. I always thought kiss was something to do with sex, you know, like with it. Not, it's not. It's the chocolate kisses that molecule was discovered in Hershey, Pennsylvania. How interesting is that, right?
Yeah.
Kish. So if you go and do the research, you will see studies that show that kisspeptin increases LH, increases GnRH, increases testosterone, increases sperm count. It was the IV form. The subcutaneous form has never been shown to do this. It hasn't been studied that much. The troche form, no studies. And if you're going to have a choice, HCG to me is the most important one.
Yeah.
And it's back and it's available now.